divided into two groups, superficial and deep. Superficial for muscle and deep for muscle too. And this picture I can show you only two muscles. First muscle, it's number 6, musculus pectoralis major. All this musculus pectoralis major. This muscle begins at the sternum, at the medial edge of clavicular, at the beginning of level of through ribs and of abdomen, linea alba of abdomen. Today, when we discuss abdomen, I explain you what means linea alba, and attached to the humerus, to the crista tuberculi majoris. These muscles little similar because they both attached to the humerus, yes, but latissimus dorsi attached to minor tuberculum and pectoralis major to crista tuberculi majoris. And for function, adduction, pronaction, and flexion, because it's located in front. Adduction, pronation, and flexion. First muscle. And second muscle, it's musculus pectoralis minor. I show on the. We can see this muscle on the picture because we should delete musculus pectoralis major. It's located more deep. Musculus pectoralis minor. This muscle. This is musculus pectoralis minor. This muscle begins at the level 2 from 5 rib and attached to the coracoid process of scapula. Function presses scapula to the body. Next muscle, small muscle, this musculus subclavicularis, located between clavicula and first rib. Not have motor function, for function support the joint, articulatio sterna clavicularis. And last muscle, musculus serratus anterior. Musculus serratus anterior. This muscle begins at the level of 9 upper ribs and attached to the medial edge of scapula, to the medial border of scapula. And it's number 8 on the picture, musculus serratus anterior. This is 8. Musculus serratus anterior. Begin at the ribs and attach to the medial border of scapula. What else muscle I remember attached to medial border of scapula? What else? Of back? Rhomboid muscle. So they are together making a loop and press scapula to the body. Musculus rhomboidus and musculus serratus anterior. They together attach to medial border of scapula and press scapula to the body. And about superficial muscles, this is all, not difficult. Pectoralis minor, below pectoralis minor, musculus subclavicularis, yes, and musculus serratus anterior. Understand superficial muscles? Yes. It's not difficult. And for muscle 2, they located in the intercostal spaces. Located full the intercostal spaces. First muscle, musculi, because they a lot of musculi intercostalis externi. They begin at the level of lower border of overlying rib and attach to upper border of underlying rib. So have direction from up to down. From up to down. Full the intercostal spaces, but only from the columna vertebralis to the corners of rib. Then continue to the membrane, membrana intercostalis externi. Understand? So external muscles full the intercostal spaces only on the back side, from the vertebra to the angles of rib. And from the angles of rib to the sternum, it's continue to the membrane. Syndesmos, not muscle. Membrana intercostalis externi. For function, rises the ribs. So act of inspiration. Inspiration, yes, inspiration. It's first muscle. And second muscle, musculi intercostalis interni, full the intercostal spaces, but begin at the upper part of underlying vertebra and attach lower part of upper yes, lying vertebra. So have opposite direction from down to up. Full intercostal spaces too, but opposite. From the sternum to the cartilage of ribs is muscle, and from cartilage to the trunk it's membrane. Membrana intercostalis interni. Understand? And function opposite. Act of inhalation, lowering the ribs. Exhalation, yes. So first muscle, externi muscles, rises the ribs, and interni muscle lowering the ribs. These both muscles fills the intercostal spaces, but have different direction and have a membrane intercostalis, externi and interni. Understand? First two muscles. And another muscle I show you in the atlas. Revise. This is musculus pectoralis major that attached to the humerus. Adduction, pronation, and flexion, big muscle. Musculus pectoralis major, yes, big muscle. Then, if we delete this muscle, we can see musculus pectoralis minor. Musculus pectoralis minor. Then, musculus subclavius. This is musculus serratus anterior, making a loop with the rhomboid muscle and presses scapula to the body, and musculus subclavius. Musculus small, very thin muscle, musculus subclavius, located between clavicular and first rib and not have motor function. Support the joint, sternoclavicular joint. It's superficial muscles. And how I say, we have a deep muscles, musculi intercostalis interni and externi. But interni full the intercostal spaces between the sternum and angles of ribs, and behind this is a membrane. And if we say about musculi intercostalis interni, externi, they opposite, begin from the trunk to the angles of ribs. Vertebral column, yes, it's main musculum. Superior, one second. Interni. Musculi intercostalis externi. So, behind, between the columnar vertebral and angles of ribs, it's muscle, and in front, between sternum and angle, it's membrane. Membrane intercostalis externi. It's two first deep muscles, and next muscle we have musculus transversus abdominis. This muscle begins at the level of xiphoid process and sternum and attach to inner surface of true ribs. Not have motor function, only support the chest wall. Support the chest wall, not have motor function. And last muscle, musculus subcostalis. Musculi subcostalis. They begin at the inner surface of ribs, have similar direction like musculi intercostalis interni, so going from down to up, but going over one rib. You see one. If you say about intercostal muscles, they fill the intercostal spaces, and this muscle begin at the level of underlying rib, then going over one rib and attached to lower surface of overlying rib. musculi subcostalis. So they going like musculi intercostalis interni, so have a similar function. Take part of exhalation, lowering the rib. Exhalation, lowering the rib. And about deep muscles, this is all. Understand deep muscles?